Thank you, SCA UK, for the invite. Thanks, Tom, for supporting me and also providing me the invite. And I am most humbled, I have to say, to be talking in front of you good people, many survivors and co-survivors. So thank you very much. So I've got the task of talking about interventions in survivors of cardiac arrest, and I'll do my best. I think probably most people know this, but what is a sudden cardiac arrest? Well, a sudden cardiac arrest, of course, occurs when the heart suddenly and unexpectedly stops pumping. And if that happens, then blood stops flowing to the brain and other vital organs. That's what a cardiac arrest is. And there's a lot of confusion, certainly in the press. The Daily Mail are probably the worst, I would imagine. They always get the blame, don't they, the good old Daily Mail. There's a lot of confusion because people use the term cardiac arrest and heart attack as if they're the same thing, but they're not, of course. A heart attack is a common cause of a cardiac arrest, but it isn't in itself a cardiac arrest. I put this slide up because it's important for people who are dealing with cardiac arrest sufferers to understand what the causes are. And I just wanted to show you guys what the causes are as well. So this is the cardiac causes, and I'll come on briefly to non-cardiac causes in a moment. But you'll see that a big chunk of the pie there is acute myocardial infarction, AMI, which means a heart attack. And then another big proportion of it is people who have got coronary disease who have had previous heart attacks, and they've now got scar tissue in their heart. And then there's a whole stack of other causes, and they're equally as important because those whole stack of other causes make up 2/3 of the pie. And you'll see that just towards 11 o'clock, there are quite a number of people actually who we just simply don't know what the cause is. It's important to understand also that the causes are different for different groups of people, and the obvious one is there is a difference in proportions between men and women, and that's because men have a higher incidence of coronary disease. And also, there is an important difference in underlying causes between different ages. So if you're really unfortunate enough to have a cardiac arrest when you're age 0 to 2, it's most likely, if it's a cardiac cause, to be something that you were born with. Whereas, of course, if you're sort of getting towards my age at 50, then when I have my cardiac arrest, it's going to be coronary disease, I suspect. We mustn't ignore, obviously, the non-coronary related causes, and in particular, the non-cardiac causes, so something completely unrelated. And of course, rather sadly, we're all going to have a cardiac arrest, that is for sure, at the end of our lives, and that's obviously natural. And people tend to die of natural causes, often that are non-cardiac, but obviously at the end you have a cardiac arrest. But for those people who have a sudden cardiac arrest where their life is endangered before it should have been, then there are some other non-cardiac causes which are sort of listed here, and I probably won't say too much more. Now this may or may not work. Let's see. So there is a very short video that I'll show that I'll stop if it goes on too long or gets too boring, because it explains a little bit about what coronary disease is. So I hope that that brief video there that's been lifted unashamedly by me, because it explained it better than I can, just explains what coronary disease is. And although this is not obviously a conference about coronary disease, thankfully, it is important in this context because it's the commonest cause of cardiac arrest. So what is it that we do at a centre like the one that I work at in Essex? Well, what we really provide is a treatment for patients who are unfortunate enough to have a sudden cardiac arrest. And the reason that we consider ourselves reasonably good at it is because we have all the expertise and the equipment to be able to diagnose the cause of your cardiac arrest and treat it efficiently. So, for example, things like easy stuff like the ECG, the electrocardiogram, which there's a picture of a gentleman having that attached to his chest to record an electrical tracing of the heart. And the electrical tracing of the heart is incredibly important when you've just been resuscitated from cardiac arrest, because it gives us big clues as to whether you're having a heart attack or not. And if you are having a heart attack, it's important for your survival that we get that treated as quickly as we possibly can. Here's an example of a coronary angiogram. So this is something else that we also do, and there'll be, I'm no doubt, people in the room who have had this done. For those people who haven't had it done, this is what we have to look forward to. So on the left is a picture of a left coronary artery, and we've got a catheter moving up this from here, from the leg, but we often go now from the wrist, moving up and over the top and then poking into the left coronary artery here, and someone is injecting contrast material down the coronary arteries, which gives us a roadmap, if you like, of the coronary circulation. And here on the right of the screen is the same thing happening with a different catheter that goes into the right coronary artery. So this is the kind of thing that heart attack centres and cardiac arrest centres will be providing for patients, or some of the patients who have had a cardiac arrest where we believe the cause to be a coronary related problem. Here we have some examples of a patient who has come in with a coronary related problem and who has had a cardiac arrest. And in this patient, I don't expect you to be able to diagnose it perhaps, but there's a blockage in one of the arteries at the top here called the circumflex, and there's a tight narrowing in here, which is the artery down the front of the heart called the left anterior descending artery. And in this circumstance, this patient has gone on to have a stent positioned across the narrowing down the front of the heart, and when that stent has then been expanded and deployed, we've got what looks to be angiographically a very nice looking artery again. And so this is the type of intervention that can be very important in a reasonable proportion of cardiac arrest patients. Here's just another example of the same thing, but in a different artery. So this time in the circumflex artery. This is the stent being deployed, being expanded up with a balloon. And then here down at the bottom right, we've got the result. And this is something that cardiac arrest centres and heart attack centres can provide pretty quickly. A procedure like this would typically take us maybe 30 minutes. The key is getting the right patients to us in a resuscitated state so that we can provide this treatment rapidly. Coronary atherosclerosis, which you've just seen a video on, is not the only thing that can affect the coronaries that can cause cardiac arrest, however. Here's another example, again in the artery down the front of the heart, and it looks like this patient's got a narrowing that perhaps we should stent. But interestingly, when we take a closer look at this with something that we call intravascular imaging, where a small little probe is put down the artery to give us a very clear picture of the wall of the artery, in a normal bit of the artery, it looks like this. In the bit where we get to the narrowing, we get a surprise, and actually this black rim around the artery that's squashing the artery inward is actually blood. And so this patient's actually had a spontaneous coronary artery dissection where blood is now accumulating inside the wall of the vessel. So this is not fat accumulating, this is blood. It's like a hematoma, a bruise, if you like. And this has a completely different treatment and prognosis. And therefore, again, centres like ours are fortunate enough to have the expertise and the equipment to be able to diagnose these subtle differences. And then finally, finally we have this example, which is an example of someone who has coronary spasm. So again, there's no furring up of this patient's artery, there is no dissection of this patient's artery, but actually what there is, if it'll play again, is the artery has gone into spasm. So on the left, the artery is looking very small and spasmic. On the right, after we've given some medication, the artery grows up. And again, this can be an unusual cause of cardiac arrest. But cardiac arrest doesn't just occur with coronary disease, as I showed you by the pie charts at the original slide. It can also happen for other reasons. And so on the left is an echocardiogram, an ultrasound scan of the heart, which is typically something we would provide patients pretty much as soon as they arrive in our hospital with cardiac arrest. And this can give us big clues as to what the heart muscle looks like, what the heart valves look like, whether there's anything surrounding the heart that's squashing the heart, etc., etc. And so that's an incredibly important test to have done pretty rapidly when you have been resuscitated. There are electrical abnormalities, and I probably won't say too much more about that because I know my very good friend and colleague Neil is going to talk to you about that in a moment. But we mustn't forget that there are primary abnormalities of the electrical system of the heart that can go wrong. So you can have a normal coronary angiogram, you can have a normal echocardiogram, your heart looks entirely normal, but there's a problem purely with the electrics that can trigger cardiac arrest. And then, as I say, there's some non-cardiac causes. This is an example. Here is the pulmonary artery, so the artery that's bringing blood from the right heart into the lungs so it can collect oxygen. And in this poor patient, there's a massive clot sitting inside the pulmonary artery, which is stopping the blood flowing through and into the lungs, and that has caused cardiac arrest. So again, important to have the right scanners in the right places that are accessible if you're going to have the best chance at surviving a cardiac arrest. Clearly, coronary interventions and tests are not the sole answer, and again, Neil will talk to you, I'm sure, more about what we do to prevent further cardiac arrests in a small proportion of patients who have suffered it. So if we have a patient who has had a cardiac arrest where we don't feel we either know why, or we feel it's likely to happen again despite our treatment, then defibrillator insertion has really revolutionized outcomes and is very important. We mustn't forget medications. I'm sure a lot of you out there are on medications, and medications are extremely important in preventing further cardiac arrest or deterioration of cardiac function. As our lifestyle changes, and I've just put a few medications up there, just for example, statins, beta blockers, and blood thinners like aspirin, for instance, and occasionally things like warfarin or warfarin equivalents are incredibly important. So clearly, we have the expertise to tell you what medications are going to be beneficial for you, but it's incredibly important that those medications are then taken. Further interventions, which a number of people have touched on, and Marco Mion, my colleague, will no doubt touch on, are interventions to treat the actual complications of cardiac arrest. And many of those, of course, are physical and psychological and cognitive, etc., etc. And at a centre like ours, we're incredibly fortunate now, thanks to feedback from our patients. We're incredibly fortunate to have the skill sets and the staff that can provide a lot of this type of thing for our patients and co-survivors. So Tom's told you that Essex is one of the best centres for this. Sadly, the acronym for a cardiac arrest centre is CAC. So, so we're pretty CAC, I would say, at all this, but I would still encourage you to come and see us. But anyway, this is what a CAC looks like. So, this is just a slide that really shows you what a cardiac arrest centre has to have, really, to give you guys and me, when it happens to me, the best chance of survival and surviving, we hope, in good shape so that you can live out the rest of your lives with good quality. We're trying to bring the right patient, what we're trying to do, and this is work from the British Cardiac Interventional Society, led by Tom and other colleagues, and this is a recent published algorithm, and you don't need to obviously know the detail, but what it's trying to achieve is, across the UK, we want equity across the UK. We want patients who we feel that we can help to go to cardiac arrest centres, no matter whether you're up at John O'Groats or whether you're at Land's End. We want all cardiac arrest survivors to come to cardiac arrest centres if we feel that there is benefit to be had, and we don't want a postcode lottery, and we're hoping that this algorithm will help to level the playing field. So, in summary, sudden cardiac arrest has many causes, and we mustn't just think it's a heart attack. Coronary disease is, of course, the commonest cause, and therefore cardiac arrest centres have got to be able to deal with coronary disease as an emergency there and then. Treatment of cardiac arrest patients really should target the underlying causes, and of course should also target preventing complications of cardiac arrest. And those are not only complications that occur whilst you are in hospital, but all of those complications that that have already been spoken about that happen beyond your hospital discharge. And I believe, and I think Tom believes, and I think a number of people believe, that specialist cardiac arrest centres are best placed to provide all that is required for the survivors of sudden cardiac arrest. So thank you for listening, and I'm more than delighted to take any questions.